that will be still the art here at Woodhull Hospital. But we're also working on
am I happy to be here. Happy to be home at Woodhull Hospital with Alejandro, who's with me here today. Say hi, Papi. Alejandro, of course, Alejandro was born in Woodhull Hospital, so he's one of yours. And his midwife, Miss Helena Grant, is here with us as well, so I just want to thank her 100 times over. That's Auntie Grant. So he doesn't want to say, so he's going to be standing by my side here. So I'm Antonio Reynoso. I'm your Bklyn Borough President, and of course very happy to be here this morning, not only because I'm here at Woodhull, which is my hospital, but also because I'm back home in Williamsburg and get to see a lot of familiar faces and friends that I've missed. But also, the most important thing that we're here to talk about is saving lives. And that is what I've been tasked to do as an Afro-Latino man in ensuring that Black and brown women get the same opportunities, the same outcomes, and that we build equity into a system when it comes to childbirth. And 4 years ago, my wife had Alejandro here in this hospital. And I was introduced to maternal health in a way that I was never expecting. And if anyone here knows anything about Miss Helena Grant, is that she will take advantage of any opportunity to educate somebody on mortality, infant mortality, and Black maternal health. So as I was coming in every single month, alongside my wife to make sure she's getting her checkup, Ms. Grant pulled us to the side and gave me about a 1-hour lecture every single time. And said, let me tell you about this, and let me tell you about that. And it was remarkable to me that 9.4 times, that's the rate at which Black women die as compared to their white counterparts when it comes to childbirth. 9.4 times. In 2022, in the richest country, in the richest city, in the greatest borough. And I thought that that was unacceptable. And it turned me from an advocate, a passionate advocate, because I was, to somebody that wanted to affect change. I wanted to not feel hopeless anymore. I felt like I couldn't help my wife in any way, shape, or form. At that moment, as a city council member and having the influence or the power that I have, was completely helpless at her bedside. There were historical health complications that existed. There are bias that exist. There were so many variables that I had no control over that existed. And I said, not anymore. Moving forward, whatever I can do, I will do. And that is why we're standing here today at Woodhull Hospital. I made a campaign promise to all of Bklyn that once I became borough president, I will spend every single dollar that I have in my capital budget to protecting Black women in Black health during the maternal process or during childbirth. And that is exactly what I did. We spent every single dollar, down to the penny, in our public hospitals, in Kings County, Coney Island, and Woodhull Hospital, in outfitting them with state-of-the-art birthing centers. So today we're here because Woodhull Hospital got $11 million of that money. And I want to say that I would have given more, but you only needed $11 million because there was already a process or a progress being made in Woodhull Hospital in supporting maternal health under the great leadership of the folks that you see behind us. What we needed to do is make sure that the facilities that we had in place matched the energy and the strength of our midwives here in Woodhull. And that is what's going to happen here today. Now, we don't want just any regular run-of-the-mill, this is for you, Dr. Katz. We don't want any regular run-of-the-mill facility here. We don't want new paint jobs and new beds and then call it a day and keep it moving and we're all happy because it looks new. We want things in this site, in Woodhull Hospital, that you don't see around the world. I want people from other parts of the world to come to Woodhull Hospital to see the great work we're doing here in supporting Black women. And that is why it is so much money. It is a lot of money because we don't want to just be good. We want to be the best. And our public health system here in Brooklyn, in our 3 public hospitals, will be the best places in all of New York City to have babies once we're done with the outfits. Now I'm going to say a few words in Spanish because we have a lot of folks that are going to say a few words that have been helpful to getting us here. Because as you all know, it takes a village. I am put in a position that I'm extremely grateful to be in, to be able to give this funding. But I can't do this alone, and I haven't done this alone. There are a lot of people that have helped me through this. So in Spanish, very quickly. Durante mi campaña prometí dar todo mi financiamiento de capital al 2023 para ayudar a cerrar las disparidades en la tasa de mortalidad materna encontradas entre las mujeres negras embarazadas y sus compartes blancas. Hoy estoy cumpliendo esa promesa en anunciar el total de $45 millones de mi financiamiento de capital para el 2023 se dividirán entre los 3 hospitales públicos de Bklyn. Esta es la primera vez que sepamos que un presidente municipal ha asignado todo su dinero o su presupuesto de capital para el año fiscal en un solo problema. 11 de esos millones le llegará aquí a Woodhull Hospital. Mi objetivo es lograr el mayor impacto posible en el entorno de la mortalidad y morbilidad materna. Y es eso solo porque estoy aquí hoy. Now, I want to just very quickly thank the Maternal Health Task Force that I put together that are helping lead the charge. As you know, I'm not a black woman, so I wanted to surround myself with people that actually experienced it and know best and are experts in doing this work. And at the head of that table, of course, is Ms. Helena Grant, which I wanted to thank first and foremost. There are other members of the task force here. I saw Christina Sparrow was here. Christina, thank you so much. And now we're going to get on with the other doers and shakers that are helping us get here. I wanted to start off with someone who I hope is with us as long as he wants to be with us. Because when I talk about actually wanting to affect meaningful change and none of the politics, all of the real work, that is who we have at the head of health and hospitals here in New York City. It is unbelievable that he's here. And I'm going to be here at least 3.5 years. And if the people want, maybe 8. And I hope in all those years that we're together and that we're going to make the public hospitals in Brooklyn the premier hospitals in all of New York City. So please give a round of applause to Dr. Mitchell Katz.
Hey, good morning, everyone, and we're just so lucky to have the Borough President here and to have this amazing gift. And I'm of course thinking ahead because I do expect to stay around. You know, the mayor has established a clear path, right? And we know that great leadership always comes from Brooklyn, right? And so, right, Borough President, right? I want to sort of note the amazing members of the City Council who become Borough Presidents, who become in the future 8 years, term limits. It's always good to think ahead, right? One of the things that I love about Antonio and that he and I have in common is that we and our families all get care at health and hospitals. Right. In fact, my daughter still says, and she's gone to several of our hospitals, that Woodhull is her favorite. So she had a great experience when she came here. We know that public hospitals deliver the very best of care because we are a mission-driven, unionized group of people who really care about our patients. We come here out of mission, not to earn the highest salary, but to do the greatest good. And that's what public hospitals are all about. And all of you are amazing people for working here, and I'm so grateful to you for the care that you deliver to our patients. What Antonio is helping is that sometimes our facilities are not as great as the people who work in them. So we already have amazing, amazing midwives and obstetricians, nurses, social workers. What we need is a facility that's every bit as great. And thanks to you, we're going to have it, and I'm here for the long haul. I love Woodhull and health and hospitals, and I'll always be a Brooklyn champion. Thank you all.
Dr. Katz. Now to bring up Dr. Michelle Allen, who's here with us today, who's the Chief Medical Officer for New York City Health and Hospitals, also OBGYN, and passionate about equitable female healthcare. Thank you so much.
Thank you, Borough President. Just a few words. First of all, to thank the Borough President for contributing and supporting and being an ally of the public health system. I've been an obstetrician for a couple of years. I'll tell you afterwards how many. But this is our lifelong passion. Myself and Dr. Wilcox will be speaking next as obstetricians, gynecologists who devoted our careers to the public sector. And we're totally focused on the disparities, the racial disparities in birth outcomes. And you can think of it in three buckets: what the providers provide through their cognitive knowledge and their skills, what happens outside of the hospital in terms of social supports and social determinants of health, and the facilities with which we are working in. We're committed to our midwives as well. I tell a story to everyone that my daughter would not be here if it weren't for the midwives who I was working with at Harlem Hospital. I was a month early, and because I'm a linear, concrete thinker, I couldn't be in labor. And the midwives I worked with took me aside and said, Michelle, these are contractions. It's not the baby dropping, you're in labor. And let me teach you how to breathe. And with that, I was able to arrive at the hospital at 9 centimeters. But it's not just the midwives that I worked with, it's the midwives that I learned from. As a resident at Jacoby Hospital, many of the nurses were midwives, lay midwives of their country of origin. And then my first job at Harlem Hospital, working with a quintillion of midwives who were just spectacular. So Helena is helping us now. She's the co-chair of our Midwifery Clinical Council. Our intention is to embolden and spread the midwifery services that currently exist in our 3 facilities that don't have midwives, to actually bring them there as well. So it's the physicians, it's the midwives, it's the nurses, it's the PCAs. It takes a village. And the village exists outside of these 4 walls. But within these 4 walls, to get a new birthing center, to get renovation of our 6 L&D rooms, and to get new ORs. Thank you, Mr. Reynoso.
Thank you, Dr. Allen. Now, she just mentioned Dr. Wendy Wilcox, and I want to say that when we first started this journey, it was a lot of work to figure out exactly how we were going to get this done. And as soon as I met Dr. Wilcox, she said, don't you worry about it. We're going to figure this out, and we're going to do it together. And she's been with us every step of the way, and I just want to thank her for everything that she's done. Dr. Wilcox.
Thank you so much, Borough President Reynoso. And I'm going to talk about the first time I met Borough President Reynoso, which was at another event this past January at Kings County Hospital. The event was about maternal mortality, which you heard the Borough President mention, that in New York City, the risk of a black woman dying more than a white non-Hispanic woman is 8 to 9 times more likely, which is unacceptable. And in the United States, that rate is 3 to 4 times more likely. And so what really struck me is Borough President came right up to me and said, Dr. Wilcox, I like what I'm hearing. I want to make Brooklyn the safest place for women and families to give birth. He said, I want to make it the safest place in New York City. And I was all for that. And then he paused, and then he said, I want to make it the safest place in New York State. No, forget it, in the country. And then he paused one more time, and he said, I want people from around the world to come to Brooklyn, New York, and say, what are you doing right here? What are you doing to make birthing the safest with the highest quality of care here in Brooklyn? And I was sold. And I said, whatever you want, Borough President, I'm with you and I will help. So I'm more than honored to stand here to thank you for your commitment, because as you heard, he not only made a $45 million down payment on that commitment, but he also operationalized it with the task force, which I'm honored to co-chair with Director of Midwifery here and queen of all things, Ms. Helena Grant. And when I say that, I'm not being shy. If you look at New York State, Ms. Grant is the chair of many committees and is helping New York State figure out how to give equitable care to all birthing persons, and that is of the utmost importance. So it's a privilege and an honor to work with you as well, Helena. So with all of that, thank you, Borough President. We are grateful to you and really, truly honored to work with you on your commitment to make Brooklyn the safest place for women and families to give birth. Thank you.
Thank you so much. Thank you so much. And yeah, this is not just about the physical space. There's a lot of changes that need to happen and many variables that go into why we're at 9.4 times the rate. So we're taking this very comprehensively. You cannot be the safest place for Black women to have babies in the world if you're just worried about the facilities. There's a lot more that goes into it than that, and that's what the task force is helping us out with. And we're also allocating a significant amount of funding to the task force. They're responsible for it, for education, information, and we're also asking for all the executives of these public hospitals not only to have midwives in their program or have a midwifery program, but to censor midwives in the birthing experience. They have to be the primary care provider for the women that are having babies, because we know that helps bring down the rate. Many hospitals say that they have midwifery services, but they're B-level players that come into the room on occasion and are being told what to do by surgeons and doctors. That is not what we want to see. We want to allow for midwives to be at the top of that food chain, helping direct everyone else in those rooms in an assurance of the health of the woman. Now, this all came to me, I didn't just wake up one day and say I was going to do this. It came to me because of the director of midwifery services here in Woodhull Hospital and Auntie Helena Grant, who also was Alejandro's midwife. Think about where we are today and how it all started. It was the director taking time to talk to me as a council member, to educate me and inform me on this issue. And in doing so made it, if not the most important issue, but one of the most important issues on my agenda as Borough President. It all started with Ms. Grant pulling me to the side and saying, you need to learn about this because no one's doing anything about it, or not enough people are doing enough about it. And I want to thank her because this is all a culmination of her advocacy and her work and her life's work. So while I am bringing her up, I want to also give her a thank you because this is your day as well. So I want to thank you to your director, Alejandro's auntie, Helena Grant.
Greetings and salutations, everyone. I'm really proud to be here. This is really, for me, about looking at what it means to be a student. The beautiful thing about Antonio Reynoso is that he is a fabulous listener, he is humble, and he becomes a student of what's important. A lot of other council members could have stepped in and had their family care, their wife taken care of during the pregnancy, and not really taken into the depths of their soul, because this really is soul work, the information being given to them. But he wanted more, and he wanted more. And in time, he's saying I would pull him aside. He started asking me deeper questions about this issue of maternal mortality and morbidity, specifically Black maternal mortality and morbidity. And so he is a student. He is also a promise keeper, because a lot of politicians and electeds will say, I'm going to do A, B, C, and D. And they don't come through. Not only did he give his he didn't give part of his capital budget, he gave it all. That's how important this issue is, and it demonstrates deeply not only his listening skills and him being a promise keeper, but it demonstrates the type of human being he is. It is very rare that we get to witness a leader with this type of spiritual value system. And so those of you know me know I'm gonna lean spiritual. It's important to really lift him up, to support him, and to really understand this movement is undergirded in knowledge, but it's also undergirded in the spiritual value system of the choices that he decided to make. With that, I would be remiss if I didn't shout out the folks on the stage. It's really important for people to understand what makes midwifery thrive in an environment. Midwifery has thrived here at Woodhull, not just because Helena Grant is the director of midwifery. Yes, Helena Grant has a big mouth. We all know that. But it's not just because, it's more than that. It's because of Dr. Katz's leadership. It's because of Michelle Allen's leadership. It's because of Wendy Wilcox's leadership on the Women's Health Council. It's because there is no thing that I've ever gone to Mr. Calise or Dr. Fishkin, who's sitting there, and asked for when I could give a good reason. They did not open the doors for me. It is because of the leadership in the OBGYN department, Dr. Costell, who's not here, Dr. Thomas, Dr. Schiffman, who's right there, Dr. Blissett, who is has become an honorary midwife in her physician role and really changed the course of how she does things in the space, and because of Ms. Crawford, who is my partner in crime, our nursing leader, and because of Ada Villatori and our whole outpatient staff. It is a montage of people that make this happen. And so we are very grateful for this gift. Not only is this space going to be beautiful, but we are committed here to continuing ensuring that what happens in the space is beautiful. Because a lot of spaces look beautiful, but what happens in the space is not beautiful. So not only do we want, or do I want, I believe in something called the 3 S's. I believe that birth should be safe, satisfying, and a sacred experience. I really believe in what is known as the ancient midwifery model, that the midwife is a community provider. The midwife has one foot in whatever space she is giving care, and her other foot is outside. And when you have a foot inside and a foot outside, that is what creates the synergy, that is what creates the trust, and that is what ensures that what happens with the patient population you serve becomes a shared decision-making model, because there is a knowingness that transmutes between all parties to know that you want the best care and that you are there to provide it at all costs. And so thank you for ensuring that the space looks like what we hope to continue to give here at Woodhull.
I'm so grateful to Ms. Grant, and I just want to shout out that Jennifer Gutierrez, who's now the councilwoman of the 34th District, also had her baby in Woodhull. And I think it's important because elected officials specifically talk about public education, and all their kids go to public education. Because God forbid they're campaigning and their kids went to private school or somewhere else that isn't a public education system. But when it comes to getting their health care, they don't necessarily think about their public health institutions like Woodhull Hospital. And I want to change that. It should be just as important that you, as an elected official, are getting services in the same places that all of your constituents are getting services, but where your money is. If you're spending your money there, you should be holding people accountable for the services that you expect at these places. And I hope we're starting a trend. And I know there's some people that have recently been married, Lincoln Wrestler. Just saying, I need some nephews and nieces too. So I'm talking to the grandparents, trust me, we're working together to make it happen. No, but I do want to say that I'm happy that I came here. I'm so happy that I came here. The services were extraordinary, but I learned a lot as well. And I'm glad that Jennifer Gutierrez, the current council member, also took that step in doing so. And I want to be clear, we didn't put our wives' lives at risk. We didn't put our babies' lives at risk. We didn't take a gamble by coming to Woodhull Hospital. We got extraordinary services here, and everyone else should be afforded that same opportunity. Now, while I call this my hospital, when I was the council member, I said this was my hospital, even though it was across the street from my district. It wasn't in my district, but I love Woodhull so much. It's like a purple or a gray area here in this corner. But there is actually an elected official that represents this area that has been front and center in this work. As soon as he got elected, he called me and said, how can I be helpful to Woodhull Hospital? And I'm just grateful because there needs to be a clear line of whose responsibility it's all of our responsibility. But we need the council member to take ownership of it. And I feel like the next 8 years are going to be a very great time for Woodhull Hospital in seeing the type of leadership that this young man is going to bring to you. You are going to be so happy that you have Councilmember Chiose as your council member representing Woodhull Hospital. And I want to bring him up. Councilmember Osei is also the chair of the Bklyn delegation. So he's playing double duty here today. And as chair of the Bklyn delegation, when I was there, I was able to get some funding for Woodhull Hospital for an emergency room. So just know that there's a lot of opportunities here. And now you're a council member. Remember, your individual council member is also the chair of the Bklyn delegation. So whoever's in charge of capital requests, make sure you reach out to him before he leaves the building. Your council member, Chiose.
Thank you. Thank you. Good morning, everyone. It's quite the introduction. Thank you, Borough President. You know, I want to start by saying that we are in very precarious times, especially when it comes to health care for women and those that can carry children. And to have a man as our Bklyn Borough President putting all of his capital funding into a hospital that supports Black and brown women and those that can carry babies is historic and amazing. So let's give a round of applause to that. And I'm also lucky because that money's going to a hospital in my district. So, you know, as an individual that represents the 36th district, which is a historic, predominantly Black and brown community, this is a topic that we hear day in and day out from the women within our district. You know, there's a lot of politicians now more than ever that are talking about the problem when it comes to Black maternal health, yet people are just talking about it. No one's providing any solutions, no one's putting any money towards this issue. So again, to have an elected official as our Bklyn Borough President doing just that right here in Woodhull Hospital, where he shares an experience that many of our families here in Brooklyn, New York, and New York City as a whole are experiencing is just phenomenal. And you know, as your council member here in the 36th district, I will say, not only as co-chair of the Bklyn delegation, you know, as an individual council member, you know, we did advocate and were able to secure $1.7 million to Woodhull Hospital in this past budget. And, you know, both of us, all of us in this room acknowledge that this, you know, is a staple of healthcare here in Brooklyn. All of our elected officials in North Brooklyn, in Central Brooklyn need to acknowledge that because Woodhull needs our support. I'm here to support you all, and I'm looking forward to working with you all for the next 8 years. Thank you.
All right. Good job. Yes, I do want to acknowledge 1.7 million? 1.7 million from Councilmember Chiose. So I wanted to thank him, and I think Councilmember Jennifer Gutierrez gave $500,000 as well to the project. So I want to thank both of them for their contribution to this great effort. Now, and you're going to hear it when she comes up. This council member is entrenched in nursing services and healthcare services. Is my sister from the other side of Brooklyn, but has been a great advocate in the Health and Hospitals Committee, as chair of the Health and Hospitals Committee, and is dedicated to this work, and is also someone that once they found out that this initiative was something that I wanted to do, said, what can I do to help? I'm here for you. And there are people with experiences and knowledge that I just don't have, that have been just sharing and pouring and giving us support to make things like this happen. I want to bring up my sister from also the other side of the island of Hispaniola, in Quisqueya, Councilmember Mercedes Narcisse.
Good morning. Precious morning to all the medical staff, professional that in every space of the hospital of New York City, and most importantly, all our public hospital, like you said. I'm in agreement with you. Thank you for being in the space to serve, knowing that, like Dr. Katz just mentioned, it's not money. It's about serving, the passion and the compassion to serve. And that's why, after I graduated from nursing school, I ended up in Elmhurst Hospital. Yes, of course, they give me a little incentive at the beginning, but I stayed there. I stayed there for many years because I appreciate what I was doing, is serving the people of my community from all over the space. I'm talking about, if you want to know a hospital, not only pushing Elmhurst Hospital, but I've been here too, and I see the service that you're giving. And thank you, Woodhull, always give me an opportunity. I used to have medical and surgical supply. I used to be all over the floor here trying to talk to discharge planners, and you always welcome me. Thank you. Now I'm in a space as a chair of hospitals. What do you think I'm gonna do? Serving the public hospital, most importantly. Yes, we need our fair share. The public hospital are the ones that serve those that are undocumented, those that don't know where to go in the middle of the night. We never turn them away. Thank you. And we have every reason as a city council members to make sure Borough President, which the leadership is in your hand, and I love to follow you, by the way, my brother. I commend Borough President Antonio Reynoso for taking such an aggressive and necessary action to help. And you know, when we're talking about racial economic, this Borough President is a leader of making us understand our responsibility, where to put money, and you lead by example. I want to thank you. We're talking about racial and socioeconomic disparities in maternal health. You took the lead, and you're not a woman. I appreciate it. I love when you're talking. You make it much more easier for me to ask for money in the city council. I said, you see the Borough President Antonio Reynoso asking for the money. He's not a female, but he understood, and he keep at it. Thank you. As a healthcare registered nurse for over 3 decades, if you want to address the inequities in healthcare, you know where to put the money? In the hospital that serve the underserved that we call in our community, which is all the public hospital. Most importantly, we're talking about Woodhull today. Thank you. I am so proud to stand with you. Birthing centers, such as this one here, will soon be located in Woodhull. You allocated $11 million from your capital budget. This is awesome. This is amazing. Thank you, because we are addressing the injustice that's being done in maternal health that we should have done a long time ago. So thank you. I look forward to working with you, to partner with you. I can tell you, I'm on budget and negotiation. Every time we turn around, I said we have to address the inequities in maternal health. We cannot let that happen on our shift. So I'm happy to report to you that this city council, this group, this class, we are pushing forward. And then you mentioned my colleague, Eutheris. She is on top of it. You're talking about Chiumose, on top of it. You're talking about Lincoln, forget it. I'm in a hallway. What are we gonna do? What are we gonna do? So I am so proud to tell you I'm gonna continue working hard. My name is Mercedes Narcissus, you can remember it. And a nurse, I cannot walk away from healthcare. We need to address all the inequities, and especially in maternal health. Thank you. Thank you, my brother. Thank you.
Thank you, Councilmember Narcisse. The next person that we're gonna call up is someone that I didn't ask for help, but came to me and told me, what can I do to be helpful? Can I push the Bklyn delegation? Who can I talk to help you with your initiative with maternal health. And I want to tell you, he's one of my closest friends in this work. I started with him when we were 22 years old doing this work. Not necessarily maternal health work, we're talking about politics. But Lincoln Ressler shows himself up constantly as an advocate for the disenfranchised and the people that need the most help. Comes from a very privileged district and uses that privilege to empower communities that look like ours. And I want to thank him for always doing that and always centering himself around social justice. So I want to call up council member from the other side, the other corner of this gray area, the 33rd district, Lincoln Ressler.
I have to say, this is like such an all-star cast up here. I'm just like blown away. Every single person's remarks were just so moving, and it's because as public officials, as people who dedicate our lives to public service and trying to do good and do right, the most sacred thing we could do is save lives, right? And Antonio comes into office with the simplest of missions. More black women are dying in childbirth by phenomenal rates. How can we fix it? What can we do? And he put $45 million. I mean, that is not, $45 million is a whole lot of money. He put $45 million in one budget, in the stroke of a pen, into our public hospitals, into the places where we can address maternal mortality directly. And it's profoundly moving and inspiring. It is what public service is all about. And I have to say, if you do nothing else as borough president, this was a damn success. Because people's lives, it's real. And because hundreds upon thousands of families will have a mother that they wouldn't have otherwise had if it wasn't for this investment. So I just want to, from the standpoint of the Bklyn, as a Bklyn council member, Jen Gutierrez, who couldn't be here today but is with us in spirit always, she and I kind of represent this corner of Bklyn in the council. But Jen and I came together and we said, we've got to have Antonio's back on this. We heard from him that he was looking at a potential small shortfall to be able to outfit all 3 of the public hospitals in Bklyn. So we said, we're going to organize and make this the #1 capital priority for the Bklyn delegation, and we did. And we secured $5 million additional for Woodhull to make sure that we can outfit the state-of-the-art, modern, beautiful birthing center that's going to save lives right here in Williamsburg and Bed-Stuy. I just want to recognize the folks that are up on this stage, because to listen to to know Dr. Katz is to love Dr. Katz. I think he is everybody's favorite official in local government. Like, Mitch Katz cares about the most vulnerable New Yorkers first, foremost, and always, and it's real. It's just to spend time with him is to learn, and we are so lucky that our public hospitals, the places that serve our undocumented New Yorkers, our most vulnerable New Yorkers, that provide care when other hospitals close their doors and shut their doors, public hospitals are there for all New Yorkers. And Mitch Katz has turned H&H around, and we are doing better than ever under his leadership. And I want to thank Dr. Allen, who's done a phenomenal job, and Dr. Wilcox, I loved your remarks, and Helena Grant, oh my God, and Greg Calise, thank you for your leadership here at Woodhull. It's great to be with Emily and Maritza, but most of all, and Mercedes and Chi and everybody, I appreciate all of you and so many neighbors and friends, but we, Antonio, with your leadership, with this investment, with the clarity of vision that you brought, we are saving thousands of lives. And it is a beautiful thing, because it is people that are dying for no damn reason other than racism and inequity, and your investment is saving it. And so I just want to thank him again. Thank you all.
And now, and I just wanted to say this because, about Dr. Katz, because I forgot this. And we're almost done here, and we're gonna get to a picture. When I first met Dr. Katz, we were in the Health and Hospitals Committee, and the city of New York was talking about cuts to hospitals to meet a debt, or whatever you want to call it, a shortfall. And Dr. Katz said no, that the way to restore the confidence and the greatness of our public hospitals is to put more money into it, invest into it, don't cut. This was before the pandemic. And I just think about where we would have been if we would have taken those cuts, or we would have had a different leader that wasn't Dr. Katz, that would have said, yes, attrition is the way to go. Let's fire the nurses, let's fire some doctors, let's cut some services because we need to balance our sheet. Instead, he said, no, the way we're gonna get people back to the public hospitals is by making people want to be in these hospitals, and we're gonna invest in it. And I just wanna say, that was literally maybe a year or two before the pandemic. And then the pandemic happens, and then it's all hands on deck, and everyone loves you all of a sudden. Dr. Katz always loved you and always had your back, and I just want to thank him for that. Just that foresight was amazing. Now, we could only do so much here in the city, and we need our state colleagues to help us out every step of the way. There was actually legislation that was recently passed by the state that made it so that women can use their Medicaid, right, to get mental health services for more than 3 months. It used to be 3 months. You get mental health services. If anyone knows anything about postpartum depression and the work that we need to do thereafter, knows that 3 months is not enough. And maybe it is for some, but not for others. And what we should be doing is providing these type of services for people that just had babies as long as they need it. If they need it for 6 months, if they need it for 9 months, if they need it for a year. It should be a never-ending service that is committed to a new parent. And that is what just passed at the state level. And Medicaid now is going to allow for these mental health services for a year, as opposed to the 3 months that it had before. So, and we talked about the facilities are important, but there's so many other things that we need to do, that we need to be invested in to make this happen. And it's because of that I want to call up two colleagues. First, I want to call up my sister in North Bklyn. And I don't know if this is in your district. Is it in your district? It is in her district. I'm sorry, there's so many elected officials in and around this area. But I want to call up my sister and your Assemblywoman, Maritza Davila. Who let Camacho in? Who let him in?
That's my little hermanito. I'm so proud of him and the work that he is doing as our borough president. Give him a big, big round of applause. I just have not seen this before. I just want to let you know that in the years that, I was raised in Bushwick, Woodhull was the hospital. Wyckoff was the smaller hospital, but Woodhull, everyone would come here. I am convinced that if I could get pregnant with immaculate conception, I would gladly come to Woodhull now, But that's not going to happen. But anyway, I just want to say it's been a long time waiting. We've seen it with our own eyes. Black women have always been at the back end. It is time to fight back, right? This is the way we do this. This is the way we bring lives into this world, in a safe environment where there are all the wraparound services that women need to feel comfortable to be able to birth. Birthing is not easy. I know, I have 3 of them. Thank God they're adults now. But when you see the men getting involved, more entrenched in what the women have to go through and are learning the process of birthing, it is important, because when we're up in Albany, we are fighting men. We are fighting Republican men just to talk about our rights as women. Our rights as women. And you know what? We're showing them that in North Bklyn and in hospitals like Woodhull and with all of these wonderful experts, things can be done. We need to take care of our own background first. Our house comes first. And this is what you all have managed to do. And I thank each and every one of you, because, you know, again, Woodhull has been here for a long time. I remember when Greenpoint closed and the nurses from over there came over here. It was chaotic back in the days. And we did not have enough information. But with a stroke of a pen, $45 million, that is quite impressive. Thank you, Borough President. Thank you to you all for putting in the work and the committee that you guys put together. God bless.
Thank you. Now we have another neighboring assembly member. And this is also something that's new. North Brooklyn is really building. And we're all coming together because when we are all working together, we can accomplish so much more. There's less divisiveness, and there's all the elected officials saying all hands on deck on every single issue. And we have a new partner in crime, or a new partner in health, is what I'm gonna call it, in the North Brooklyn, our Assemblywoman, Emily Gallagher. Please, Emily, come up, please.
I am so proud to be part of the North Brooklyn Government Coalition. What the Borough President said is absolutely true. We are really a unit, and we are a unit that's focused on social justice, and this has exemplified it set a bar and a threshold for the rest of us of what this looks like and what this does. So I'm really grateful for the Borough President. Many politicians will settle for cosmetic change over real change because they can spread their dollars out and get a lot of accolades for doing very little. But Antonio did the opposite, where he said, I'm going to give enough money to make a real difference, and I am going to give enough money to actually save lives and to change the status quo. Black maternal mortality is an open secret in white communities and in the halls of government, and that just means that it's an ignored reality. And it takes somebody like Antonio Reynoso to change the status quo and make a real investment in critical life-saving change. To invest in a public hospital is a promise that the Borough President is willing to take positive risks and prioritizes the lives of his most vulnerable constituents. That's something that every resident gets to be proud of, and every taxpayer gets to feel good about, because so many people are so frustrated with how our tax money is spent. And this is a way that we can see that our tax money is actually going to our community and to our society. He's a great example of a male feminist ally in a time when women, especially Black women, are having their lives and choices diminished terribly by federal policy. So it sets a good example for all of us that we really need to think about what real change looks like. And this is a good reminder for me to keep my focus and my eyes on what will deliver the most benefit and the most change to the most vulnerable in our community and in our shared community. And I promise you that I will keep anti-racist policy and feminist policy and social justice policy at the forefront of my platform always. This is something that I think is really important, and I'm really proud to be here and just bask in the glow of this achievement. So thank you to everybody at Woodhull and for the life-saving work that you do. I am childless. I am recently married. Thank you for not saying that I needed to have a child. But I am really, really proud to know that if I did make that choice, that I have a safe place that I can get to quickly, and I can become part of a lifelong community. So thank you very much.
Thank you, Assembly Member. I do want to acknowledge the Chair of Community Board 4, Camacho, who is here. He did come into the back door, but he made it in. He made it in. And I don't think they're Community Board 1, no, but they're here in spirit. And now we get the cool part of today is I get to hand over a big check to Caliste and to Woodhull Hospital for the $11 million. So I want everybody to, we're gonna do it up front. So we're gonna step up front and we're gonna hand over the check. And this one you cannot cash, Khalees. You can't cash this one. The real one is in the mail. But thank you all. And I want 2 pictures, so I do want a picture with the folks that were on stage and the elected officials. But I want one with everyone that touches a baby or helps a baby in any way, shape, or form in this hospital. So please come up as well, because this is yours as well. So we're gonna start with this one, and then the second one is all the people that touch the babies. Thank you so much.
Sir?